Hi, this is Dr. Sandy, and today we are with
Dr. Cristian Rodriguez.
And we will do some talking about advice, important topics, a lot of things today. So stay tuned if you want to hear this information. And we will start with how us as weight loss surgeons prepare ourselves for the day and how preparing ourselves will change our mindset in a positive way to take better decisions during the day. So something that I consider that is very important is how we start the day and how this can impact all of our day, all of our week, our year, our life. How do you prepare yourself in your daily basis? What's the first thing that you do in the morning?
Well, discipline is the most important part on this, and I believe hydration is one of the most important part for
That's
me.
good. Yeah.
I start the day with hydration, then I prepare myself to go to the gym. In the morning is the best time for me to go to the gym, to exercise, to start activity with mobility, with muscle strength. So hydration and
The warm up for surgery, right?
yes, yes.
So as you see, you have, if you choose us as your surgeons, you have fit surgeons that do exercise in the morning. For me, it's very important to do it in the morning because it changed my mindset to taking better decisions during the day. Maybe if I already did exercise, I will choose a more healthy meal than if I don't do exercise and then I say, well, I didn't do exercise, maybe I should eat crappy food. So it can change your mindset in a positive way, right?
And what is your first meal?
My first meal, right now I'm preparing myself a milkshake with kefir and protein. And this would be like my first meal besides coffee, of course, a lot of coffee in the morning. But yes, that would be my first meal in the morning. And I would do some cardiovascular activity and as well some weightlifting to grow muscle and longevity, right?
Yes. And right now I'm doing a lot of breathing exercises, like yoga, like hypopressive breathing, so that I feel that I can have more oxygen to my body.
Yes.
And start the day with protein and oxygen and water.
Yeah. And as well, like the hypopressives straighten the core and can help us with our posture during surgery as well. I think that's important.
Yes.
So as well as it impacts in a positive way, it can impact in a negative way, starting your day maybe a little bit more lazy, not waking up at a good time, and just struggling through the day to do something positive, but maybe not getting to it, right?
Yes, and start the day with carbs. I believe it's not the best way to start the day. So we need to start for what we need, and we need protein and we need water.
Yeah. And as well, when you are preparing yourself for a weight loss surgery, starting to do these small modifications in your lifestyle will help you prepare for surgery. So if you start before doing physical activity, getting better with your hydration, modifying your habits, more your eating habits, all this will prepare your body for surgery. Maybe you will get in a better cardiovascular state to your surgery. That as well is very important. But you are changing small things in a permanent way. So after surgery, it's not easy, but it will be more easy to do something that you're already used to doing, right?
Yes, the goal of weight loss surgery is to make diet change and make activity change. That's the most important part of the treatment, and the surgery is going to be the tool that's going to make it happen. But the real treatment is diet and activity. So you need to start with good habits to make this happen.
Yeah. And maybe if it's small changes, because sometimes you think that it has to be a dramatic change from 0 to 10 in changing all your eating habits, but maybe If you start with small changes and then slowly start to progress them, maybe do one change. For example, I won't drink sodas anymore. So you just don't drink sodas. Everything else is exactly the same, but you don't drink soda until now it's a new habit, and now you can add another change and another change and slowly progress your living style. It's
Yes.
living style, right? Okay. And as well, when we have a healthy lifestyle as surgeons, one thing is as patients or as any people, but as surgeons, I think as well it's very important to stay in a healthy state, because when we are managing complex cases like revision surgeries or high BMI surgeries, it gets pretty demanding in our physical state, right? We have to do a lot of strength when we are managing the instruments to like compensate with the abdominal wall of the heavy patients. Sometimes I'm sweating. I'm sweating during surgery. You as
Yes,
well,
yes.
yeah?
And we can spend hours in surgery, so we need to be fit. We need to be healthy. We have to make decisions during surgery. We have to be focused. So we need to have mental health also.
Of course, yes.
Yes, yes.
So preparing our body for surgery is important. Having a good rest before going to surgery as well is very important. Not get like all hangover and get tired to surgery. It's like going to do a marathon already tired, then the results, maybe you will be able to finish the marathon,
That's right.
but you won't do it in a good or in a good performance, right?
Yes, and every complex surgery is like a marathon for us.
Yes. Yeah.
So
It's something that demands a lot of focus and physical effort.
yes, exactly.
And of course a lot of other medical things, but yes, it's important to get in a good state for surgery, prepare ourselves. Of course, having a certified surgeon. If you're looking into a surgeon that is not certified, then you're not looking in the correct part, right? So that would be the most basic, but other than that, you have to look for other qualifications, right? To have a surgeon that is completely prepared in all of the different areas that we can have, not only academic part, but as well physical, mentally. It's more than that, right?
Yes, because we are an example for our patients. How can you teach discipline if you don't have discipline in your life? So if you want to teach or to give good habits to our patients, you must understand what is a good habit, and you must live a good habit to be able to share
Yeah,
how
how
you
can you
can.
tell a patient don't eat this if you are eating it every day? So you have to put the example first before telling others to
Yes.
do or not do, right?
And something important is that to make the physical activity happen, you need time for that. You need several months to understand how the body works, how the muscle works, and you need to know. You have to know how is to do lifting, to tell your patients do this 2 times a week. Start with re-up, then increase the
Of course,
intensity.
yeah. It's from less to more. You can't start like powerlifting the first time you go to the gym. You have to start from less to more. And that's some of the recommendations that we give our patients: to start walking. That's enough. If you've never been used to walking, then just start walking. And then you can slowly add more effort, elevate your heart rate, slowly start to progress, right? And as well, super important to find something that you enjoy, that you can continue to do for a lot of years. Not only start to do it some days, and then if you don't enjoy it, you won't be able to continue doing the activity, right?
Right. Yes.